Hello, my name is Grant Veldhaus. I am a sophomore studying industrial engineering and computer science, and I am the chief operating officer at Blueprints.
Hi, my name is Maithili. I'm currently a junior studying public health and business, and I'm also the chief of staff for Blueprints.
Hi, my name's Yash. I'm currently a sophomore studying business, and I am the vice president of expansion for Blueprints.
And we are Blueprints for Pangaea, and our capstone project was the inventory app.
So for some quick context, the US currently generates over 10 billion pounds of medical supply surplus each year. I know that number can be a bit difficult to visualize, so let's instead think about it in terms of how many Michigan football stadiums we need to account for this waste. 10 billion pounds of waste can completely fill up 35 big house stadiums. And I'm sure if you've gotten a chance to visit the big house, that number really puts things into perspective. Now, as you can imagine, this has a significant environmental, economic, and humanitarian impact all around the world. Environmentally, these supplies end up as waste within landfills and as part of CO2 emissions. Economically, since these supplies are discarded, it means $6 billion to $25 billion worth of supplies are completely lost. And finally, in terms of the humanitarian side, millions of people lack access to these basic medical supplies. And by not having them, they're not able to get the necessary care and services they require to promote strong health. So in response to these three factors, Blueprints for Pangaea was created. Blueprints is a national student-run 501c3 nonprofit that works to reallocate excess unused medical supplies from US hospitals to places in need overseas. We do this through a four-step model. First, we partner with US hospitals. Next, we collect excess supplies from those hospitals and ship them out to our warehouse. Then we inventory these supplies and verify their quality and quantity. And finally, we ship these supplies out through independent shipments or by partnering with a nonprofit distributor. So as you can see, this is a pretty simple and straightforward process, and that simplicity has really helped us a lot with our success over the years. However, there's still some inefficiencies with this process, particularly with step 3, inventory, and that will be our focus for the remainder of the presentation. Now I'll pass it off to Yash to talk a little bit more about our current challenges.
Thank you, Maithili. So there are currently three major problems with our inventorying process. First is that the process is incredibly time intensive as we have to individually take pictures of each supply and then price each individual supply. Second is that due to a lack of an up-to-date medical supply price database, it makes it oftentimes difficult for us to accurately price our market impact. And third is that when hospitals request certain supplies due to a crisis, for example, it is oftentimes difficult for us to know exactly what supplies we have in our warehouse so we can help them in a timely manner. For example, this past January, when a hospital in Wuhan requested some supplies, due to our inefficiencies, it was difficult to help them in a timely manner. So our solution is the inventory app. There are two aspects to the app, the front end and the back end. The front end is simply the mobile web app that would scan each individual medical supply, and this would be used by warehouse volunteers. And then the back end is the desktop that would analyze the data that comes in from the front end, and this would be used exclusively by the Blueprint staff. Now, for the project specifically, we had two specific work streams, the software end and the pricing end. On the software end, we recruited a development team to help us with the app design and testing. And then on the pricing end, we engaged with a wide variety of stakeholders in multiple different industries to try to create a strong medical supply database for the future. Now I'm going to pass it off to Grant to talk a little bit more about the specifics.
Yeah, thanks, Yash. So first, we'll talk about the software development end of the project. So for this part, we followed a classic software development cycle, first beginning with design, where we answer really important questions like what needs do we have as an organization and how can our inventory app alleviate these needs? The second part of the cycle is the fun part, is the implementation part, where we vet potential software developers to work with to implement our design and actually have the design be implemented. And the final part of the cycle is testing, where we really test the quality of our inventory app to figure out if it fully fulfills our current and anticipated needs as an organization. So the first part of this cycle we focused on was design. And before even starting to code the app itself, we took pen to paper and established some user requirements and some system requirements. The user requirements are what the app should do, while the system requirements are how the app should do it. And these two terms are very common in the software development space. So to kind of give an example to make some sense of what user and system requirements is, let's say that we're building a bird box, right? So if we're building a bird box, the user requirements would be, the features of the bird box. How many cubbies will the bird box have for birds? How big will the inside of the bird box be? How tall will the bird box be? Different types of functionality that the bird box will have. And then the system requirements are the tools and supplies that we use to build the bird box. Let's say we need a hammer and nails, and we need balsam wood or something like that. Those are the system requirements for building the bird box. And that's kind of the approach that we took with the inventory app as well. And this is kind of initial sketches what we thought our inventory app could look like. So you see the login page to the far left, and you see the camera page in the middle as well. Those are, the really important parts of our app. The second part of the development cycle we implemented was the implementation stage. So in midsummer, we contracted a senior at Ferris State, which is a school in Michigan, who had a lot of web development experience. And we tasked him with creating a functioning bare bones version of both the front end and the back end of our website. So if you see the screenshot here, it's not very pretty, to be honest, but it works. And that is was the result of our time with him, was making a fully functioning front end and back end version of our inventory app. Now, in the fall, we started to work with an on-campus group of students called Atlas Digital, who works with nonprofits and businesses to solve their software needs, right? And they really took the task of making our web app and our inventory app look good. So these are kind of, the pictures of the current state of our app after they applied some, really beautiful user interface concepts to it. And the final stage was testing. So in this part of the development cycle, we sent out a semi-finished version of our inventory app to a couple of Blueprints members to get some feedback. And the main pieces of feedback we got were, that the scanning feature took a little bit too much of a long time, and that, it took a long time to actually scan the photo. So that's something we're focusing on for next semester. And the second piece of feedback we got was that our Blueprints members thought the backend console, where the front end data is taken in, could involve other departments. It can involve financial data about our headquarters and our chapters, or it could store the contact information for our donors for the development department.
So in addition to creating the software for our application, we've also been working to create a pricing database to better estimate the market value of our supplies. We started off by doing some of our own online research on medical supply pricing, but we quickly realized how complex of a topic this is and how much we benefit from talking to an industry expert. Thanks to BLI and the London Idea Project, we were able to spend this past summer meeting with notable stakeholders within the healthcare industry, such as representatives from Blue Cross, Medline, and United Health Group. And they were able to help us learn more about pricing, how to pitch our project effectively, and how to account for security and privacy when creating this pricing database. So using the knowledge we gained from these stakeholder meetings, we reached out to some internal stakeholders at the university, such as the head of the healthcare division at the William Davidson Institute, and she was able to help us gain some more insights on how to approach hospitals and gain access to that pricing data. Finally, we recently reached out to Michigan Medicine to request access for the pricing data, and we're currently waiting on a response from their team. Overall, this process has really helped us better understand how medical supply chain works, how to present ourselves effectively, and how to best build our network to ensure the long-term success of our project.
So throughout this whole process, we faced three particular challenges. First is that we quickly realized that medical supply prices are often kept confidential, which made it difficult to access. Second is even for the prices that were more accessible, they were often expensive and out of our price range. And third, we had to make sure we took proper precautions to make sure that when we reached out to individuals, when we reach out to individuals, as many stakeholders were oftentimes overwhelmed due to COVID-19. While we anticipate to face these issues in the future, we hope to utilize the knowledge we learned in the last year to overcome any potential challenges. In the same way, throughout the whole project, we made many connections to the BLI habits. First is by starting small. The project seemed daunting at first, but by breaking it up into smaller pieces, it was much easier to accomplish the larger goal. Second is by expecting challenge. Throughout the whole project, we faced a wide variety of unexpected obstacles and had to overcome them as a team. And then third is pausing and reflecting. Throughout our time with BLI, we were able to reflect on our project, and so we can further utilize our skills to expand our project in the future. When it pertains to next steps, first we hope to test the inventory app at headquarters at the University of Michigan and then expand it to all 7 of our chapters nationally. Finally, we hope to utilize this data to create a comprehensive KPI report, which we will extend out to all of our Blueprint stakeholders.
So that is the end of our presentation, and I guess the end of our Capstone project. So, it literally took a village to get our project to where it is now. So I want to take time to thank everyone that was really involved with helping make our project the best it could be. So first, I want to start out with my Blueprints team, Michael and Yash. You guys have been incredible co-leads for this project and really showed, exemplary leadership throughout the past couple months. So I really want to thank you guys in that regard. And I want to thank the other Blueprints members that aren't on this call right now, such as Kishore, Chris, and Sajin, for helping in a lot of other ways as well. Second of all, I want to thank the Barger Leadership Institute. Without BLI, we wouldn't have this project. And I really want to thank them for their, immense generosity in helping us out. Fatima and Mary, thank you for your unconditional support of our organization through both the highs and the lows of this project. And thanks to the rest of the BLI staff for helping support the Capstone program throughout, throughout these last couple months. Thank you to the London Idea, to Josh London and Jake Sherman for coordinating, monthly meetings with us to help solve not only issues with our project, but wider organizational issues we've been having as well. Thank you to the stakeholders that we met through that program as well, and for taking time out of your busy schedule to talk about Blueprints for a little bit and really help us tackle some, tough organizational issues. And finally, I want to thank the amazing Brianna Suggs for, being the best graduate advisor there ever could be. Your immense support throughout this entire program has been really appreciated, and we will be forever thankful for that. So thank you to everyone for watching our presentation.